Hey everyone, this is Mike with Peptide Strong. I know it's been a while. As you can tell, I put on some weight since you've last seen me. It's been a long time since I've done a video. I should have done a lot more in a period of time, but had a lot of life events going on. Not much of an excuse, but yeah, recap on things that when you saw me, I was lean out for a show, in contest prep. Didn't place where I want to, 6 out of 15, and got to see where I needed to improve a lot. But I'm just gonna work hard this off season and work on lagging muscle groups and be patient, put on size, and when I'm ready, I'll go in contest prep again. Right now, I don't want to get any bigger. Around my show, I was in somewhere in the 180s, maybe 184, 85-ish. I'm currently right now at 209, and I don't want to get any bigger. This is as big as I need to get, even though I do have a mean appetite. But I was surprised to see how many people liked my instructional video on how to use IGF-1 LR3. So it seems like you guys like those videos the most. But the topic I'm going to go into today is further into gut health. And I must say, the protocol that I used in the last video, well, the one before, how to use IGF-1 LR3, the leaky gut, it did work. But little did I know, I did have more health issues with my gut than I was unaware of. I started having digestive issues on and off for the past 2 years, didn't really think much of it. And, you know, I would say right after my show, I got really sick, you know, maybe about a month and a half or two after. And it just got worse. I was having a lot of digestive issues. I would have a lot of bowel movements in a day, starting to feel drained. And I talked to my friend Ricky, who's one of my clients, and he told me he sees a doctor here in Jacksonville, Florida, and she has a different approach to medicine. She actually treats the gut and how things are supposed to be done instead of the symptoms with issues. So when I saw her, she wanted to give me an Indican test. I never knew what that was. And it's something a lot of doctors don't even request from their patients. I mean, I've asked multiple people if they've ever heard of it, and nobody has known of it. Only other doctors, but um, the Indican test is a great way to test for harmful bacteria in your gut and lingering viruses. And what you do is it's a urine test. So you're going to first thing in the morning pee in the morning, and you're going to put it in the tube, and then you're going to mail it, and then they're going to give the results back to the doctor. And to my surprise, I got my results. It wasn't too good. Your Indican scale should be a 0. I was at a 5 to 6 range. And this is how important testosterone is. My doctor told me, she said that she thinks the only reason I'm getting out of bed and functioning was because I take testosterone, TRT, testosterone replacement therapy, and it's masking a lot of the symptoms. So thank God for the use of testosterone. Still one of the best things a man can take. And, it was also affecting my adrenal glands. Like, they can't really be wiped out, but they were not performing well. Like, they needed to be rebooted basically. So my adrenal glands were really affecting my ability to have, energy and causing a lot of fatigue. So, that also goes with the gut issues. Many issues are linked to your gut. Over 70% of your issues can be treated with your gut. And that's why your gut is so healthy. And so energy levels were depleted, maybe mood, and it was also affecting my ability to absorb nutrients because it showed my vitamin C was low in iron, and I eat a lot of iron-rich foods and I take vitamin C supplements every day. So I can't imagine how much better results I would have in previous off seasons or even before or even during show prep had I had this thing taken care of a long time ago. But, unless somebody can give me access to a time machine. I do hear that it's possible now, and theoretically, some people have done it maybe, I don't know. but I just have to, live in the now and prepare for the future. So, with that being said, if a lot of you are having digestive issues, feeling fatigue, uh, bowel movements, you need to see a doctor to get an Indican test. The one thing I like about my doctor, she has a more holistic approach. Instead of giving me antibiotics, which may kill it quickly, but then bad bacteria grows back right away, which is a bad way of dealing with things that a lot of modern doctors do here in the United States, sadly. Her treatment was through a list of supplements. And, I'll show you what I have. It's a lot. It's really not fun, but, it's definitely helping. The first thing I've been noticing is my energy levels. So I really think it's been treating my adrenal glands really well, and I'm having less bowel movements. So here they are. It's probably some you've never heard of. I take this with food. Caprin is amazing. Even some hospitals use it intravenously for patients. FC Silo for fungal in the body, because I definitely had some fungus in there. And some other these are for digestive support. But take this. Oh, one of them I was already aware of, which is oil of oregano. So, yeah, I have to do that, take those every day, but hey, it's my health and that's important. So, in about a few more weeks, I will test or get my urine analysis done with another Indican test, and we'll see how that goes. But I also like her approach to, her medical approach, because she disagrees with how doctors in the United States overprescribe statin and are wanting to keep, especially men's cholesterol levels, too low. Whereas a lot of doctors want my cholesterol to be under 160. She says over in France, where she is from, it's normal to be at 180 to 220. And interesting fact I did not know was that having too low cholesterol is a significantly higher chance of dementia. So you might want to talk with your doctor, find a different doctor if they're trying to keep your cholesterol levels too low. And the other thing, what's interesting, of course, I don't want to get off topic too long, but dementia, if you read by study, a lot of people in study they found that have dementia have low IGF-1 levels. Now, of course, when you go to your regular doctor, they don't really check for IGF-1, or I don't think they check for tumor markers or things like that. And find a doctor that does, or see a hormone doctor. Make sure you know what to test for. If you don't know what should be tested for, do your research. You can ask me, or, guys, I know it'd be nice to just go to the doctor and they solve everything, but they don't. You have to do diligent research and realize that, you just don't need to submit and just think everything your doctor does is going to be great for you. That's just not how it is. A lot of doctors have been overprescribing opiates for years, and Xanax and all these issues. A lot of them want to treat you with, SSRIs and antidepressants when you really could have had low testosterone. So just, don't just go to the doctor and say, oh, okay, ask questions, do research, get second opinions. I know it shouldn't be that difficult, but, when medicine here is for profit, you have to think, do they care about you, or they care about you returning or coming back with problems, just to mask more symptoms? Well, anyway, guys, I hope this video helps for any of you that have been having digestive issues or going to the doctor and they prescribe antibiotics and you come back feeling just as bad, if not worse. You need to get down to the root cause, and just you have to get in your head that a lot of problems, whether skin, hormonal, and everything, has to do with your gut. A lot of your hormones, the special things, could be your liver, your gallbladder. These are all important organs. When things aren't working properly, they show in the surface, to your skin. So you're a dermatologist and you get a topical cream that may work for a period of time, but you may have to rely on it. Little do you know that the problem lies in your body. So open up your mind, sometimes it's better to take a holistic approach to things and find a different kind of doctor with a different philosophy. The doctor I see is trained in many different philosophies from, I think they call it Ayurvedic and, you know, don't roast me if I say it wrong, Chinese medicine and other types of different ways of treating people around the world they don't conventionally treat here in the United States. Anyway, if you like the video, give me a like, subscribe, encourage me to make more videos, guys. Get on to me. I just want to make videos that help people with their health and get out, I guess you would call it the matrix of relying on, you know, prescribed drugs when you don't need them. For example, cholesterol, if it is too high, let's say it really is like, 284 or 300, maybe you were, on a keto diet or something, I know some people are going to get wild and defend it, but I'm not a big fan of it. But I've seen some people's blood work in the 300s, and I'm like, ooh, that's from keto, huh? Well, you might not want to stay on it, but hey, I'm not a doctor. Make sure you see your doctor. But instead of them prescribing you a statin, berberine is more effective, a natural supplement, and would be much more effective, and it's cheaper. So please don't rely on statins. I have a doctor friend from Germany, and he says people who take statins are idiots. He's been doing it for years. He has a practice where he specializes in regenerative medicine and treats people with, special, certain diseases. And, he disagrees with the way a lot of doctors treat people here in the United States too. So I'm sorry to tell you guys, the United States is not the best in the world for medical advancement. I'm sorry. We're not even open-minded to all the peptides yet. So guys, get on board, do your research, learn, get interested in this stuff. One YouTube video is not going to be enough. You're going to hear a lot of different stuff. You're going to hear a lot of people telling you to do all kinds of stuff. You need this, you need to take this, you need to do that. Before you waste your money on anything, go find out the problem first. Like I said, if it's in your gut, get an Indican test. That's going to tell you what's going on, and as well as get your blood work done, and you're going to find other things wrong. So if you find a doctor who specializes it, they're going to find out what's going on in your gut, your blood work, what other hormones are being affected by this, and, then get the supplement recommendations from there. But yeah, there's a lot of great informations, but don't self-diagnose yourself based on assumption and just symptoms. Just get the Indican test. I'm sure there's other tests out there. I heard about the meridian test in your body too. That's where they test to see what supplements are good for your body. I'm willing to try that too. I haven't. If you guys have any feedback, please let me know in the comment section. I'm all about health and open-mindedness and, anything to not be prescribed or stay on drugs. Guys, let's get to the root cause. Have a good day, be blessed, and, I'll see you later.